Well, if you've ever wondered about the magic behind facelifts, tummy tucks, or even the intriguing Brazilian butt lift, or the BBL, then you are in the right place. Because today on our couch, we have Laura Johnston, CEO of Phytoceutics and Integrative Nutrition Health, as well as Dr. Willem Erasmus, plastic and reconstructive surgeon coach. And we're going to be diving into the world of plastic and reconstructive surgery with expert insight. What key procedures do people most come to you for? Like, what is the number one thing?
My practice is mostly a cosmetic practice. So we focus mostly on the aesthetics, so facelifts, boobs, tummies, and the Brazilian butt lifts you mentioned. So we used to have a reconstructive practice, and it's morphed over the years into a cosmetic practice.
I love this, and I love that you ended on the BBL, because I think social media has just gone absolutely crazy about something that Kim K really brought to the limelight. So tell me more about this BBL, Brazilian butt lift. What is it?
It's a procedure that enhances the shape of your bum. So in the past, we would discard this fat. We do a tummy tuck, or we do liposuction. We would then send that fat off to be incinerated. And now we use that fat to reshape your bum. And by reshaping your bum, we take that violin curve that some girls have, and we turn it into a very nice soft S curve.
Okay, you're saying violin and S curve, because some of us are not born with it. You get bodies of different shapes. You either straight, or maybe you go outwards instead of maybe inwards. What sort of things do we have to prepare ourselves for if that is the goal that we want to do? Before surgery, the do's and don'ts, what are we getting into?
So in general, we like very healthy patients.
Okay.
No point in you coming for a cosmetic procedure if you're unhealthy, suffering from some terminal illness. A lot of people are on supplements these days. So I ask all of them to stop their supplements at least 2 weeks before the procedure. And the main reason is for bleeding. When
it does come to that management of pre and post-op, besides the 2-week break, what are we looking at when it comes to supplementing the journey?
So Willem mentioned healthy patients, and we're all about boosting immune health. So there's something called AHCC, and it's a specialized shiitake mushroom, and it's really powerful for immunomodulation. So it helps keep you healthy. I actually take it whenever I travel, because I always get sick when I travel. And then, so that's pre-op. As Doc said, nothing to encourage bleeding, so lay off your omega-3s. And then post-op, you know, often doctors prescribe opioids that cause constipation, steroidal anti-inflammatories. We're all about the natural, so Better Gut is something that can really help with that constipation that is a side effect of these pain medications. And then non-steroidal anti-inflammatories like curcumin can assist as well.
I'm learning a lot about curcumin from you. A very interesting journey that I've been going down. But Doc, if I can come back to you, is there any procedure or even surgery that's kind of on the forefront, something that we maybe don't expect to be coming out, and you get the first-hand insight into it? We've heard about BBLs. What else is there on the market?
There's something called an injectable breast enhancer.
Tell me more. What is this?
The manufacturers have said it's going to be launched sometime in the year, but we don't know what it's going to come, or when it's going to come, or how they're going to do it, or what you can inject. So we don't know much about it. We just know that it's coming out. There's also talk of topical Botox, needle phobia. Again, we know nothing about it other than that it's on the horizon. And then in vogue at the moment is the deep plane facelift. So in the 80s, they pioneered the deep plane facelift. It's a much deeper level of a facelift. The surgeons then moved away from that, and then recently in the last sort of 10 to 5 years, it's become back into vogue again. So it's becoming a lot more popular, and people actually particularly ask for a deep plane facelift.
Okay, so it is, I would say, public knowledge. People kind of know about these things. Very interesting. I'm not saying that I'm going to book an appointment, but maybe I will one day. Laura, if there is one area of supplements that you think are innovative for plastic surgery, I mean, what does that look like?
Yeah, so when we're talking about beauty, I mean, collagen is all the rage at the moment. So there are different types of more bioavailable collagens that the body recognizes and can utilize better. So eggshell collagen is one of these. And then also, we all know GLP-1s for weight management, which I guess falls in line with liposuction and plastic surgery. So anything that stimulates these GLP-1 receptor agonists. And this largely is in the gut. Actually, there are bacteria that have shown to enhance this GLP-1 activity. So probiotics in this area.
I love that. I also love the approach of the more natural take along with options that people want to take it a step further. They're complementary. I mean, they're definitely not mutually exclusive. So thank you for offering us some more insight into that. I appreciate it, Doc. Laura, as always, this has been so insightful. I mean, from sculpting and shaping to healing and recovery, it is so clear that plastic surgery isn't just about aesthetics. It is a full body commitment. With the right preparation, expert care, and also smart supplementation, as you heard, you can really set yourself up for the best results. And of course, to learn more about this topic, don't be afraid to head over to Phytoceutics.com. They've got you covered on everything that you need.
Optimize your gut health with Phytoceutics range of pre, pro, and postbiotics. Use code EXPRESSO for 15% off at Phytoceutics.com.